Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is more so tailored towards um, back pain and sitting. We have a lot of patients that we see for physical therapy that just complain that when they sit for long periods of time, their bottom hurts or their low back hurts. So, and usually there's a couple of strategies that can help this. One of them is just being aware of your posture. Um, what happens a lot of times we find is we'll approach somebody who they're saying they're having pain in sitting, and we'll look at their posture, their anatomy, and what we'll find is that their hips are not in good alignment with the chair, or the chair is not appropriate. Um, and they're doing something that's called sacral sitting. And what sacral sitting is normally your pelvis is designed to support the weight through certain regions, and you're designed to offset the load of your trunk, the top of your body, um, through your pelvis in a certain position. Gravity is meant to act linear, straight down through your body in a certain position. However, if your pelvis is not aligned properly, your pelvis is tilted a certain way, you're putting a lot more strain on particularly your low back, um, contributing to pain from your discs pushing on your nerves and your joints not being aligned properly. So we'll talk about sacral sitting. And this picture has somebody in a wheelchair, but a regular chair is the same. It's the same thing. Essentially, the wheelchair is just here to describe the person in the chair. So this first picture demonstrates pretty good alignment. Down here at the bottom, you can see it a little bit. The person is, well, this would be considered a little bit of sacral sitting, just because if you see these bones at the bottom, these bones at the very bottom where your butt is, are designed to offset the load. And I'm going to come down here to this pelvis. This bone at the bottom here is called the ischium, and there's an area down here called the ischial tuberosity. On the very bottom, you can feel it on yourself if you poke yourself in the bottom, and you can feel a hard bony structure. That's the ischial tuberosity. That's where naturally you have more musculature that attaches to this area that can support the weight, so you're not putting as much focal pressure on your back. Unfortunately, what happens through gravity is we end up slumping in the chair and end up in a position called a posterior pelvic tilt. So I'll just sort of describe it with my hands. So imagine my hands are the same picture as the pelvis, the one in the picture that says neutral pelvic position. It's in a good upright position. Everything is aligned properly. But as we sit and as we slump in the chair, that pelvis rotates backwards a little bit. Hopefully you can see I just rotated my pelvis backwards, putting a lot of pressure on the structures back here that aren't designed to support that focal load, because the musculature is not as dense back here versus in the bottom. Also, it puts a lot of strain on the low back, which is connected up here, which you can see. So ideally, in this picture, this person's in a wheelchair, but in a regular chair too, the hips would be a little bit farther back, so there's not so much of a gap. That way, the person is supporting themselves on their ischium a little bit more, and the posture is more upright. So I've got a couple of other images to just illustrate this, but I want you to think about this pelvis position. So, and again, you want a good upright pelvis, and as you want to maintain that versus slumping down in the chair where the pelvis rotates backwards, putting a lot more pressure on some sensitive structures in the back here. go to some other pictures. This is an exaggerated picture of sacral sitting. Again, this is in a wheelchair, but the same logic goes for just a standard chair. You want your hips back. You want your back at least through your mid back against aligned and supported by the back of the chair. And notice right here that it's labeled ischial tuberosity is supporting the axis of the spine. So this top linear axis is very straight, supported, and that the force of gravity acting downwards through the body is all supported by the ischial tuberosity as it's assigned. This picture to the right here, obviously this picture, this guy has slumped forward. As you can see, even though his ischial tuberosity is still touching, the force of gravity acting through the body is in a different location, more on the lower back area, the sacrum and the coccyx, and then there's an exaggerated curve to the back. This unfortunately is putting a lot of strain on low back structures, contributing to pain. So this picture on the right is what we commonly see when people say they can't sit in a chair for a while because it just gets uncomfortable in their low back and their bottom. Well, when we actually examine them, they end up having this position versus this upright position, just because one, oftentimes they're not conscious of how they're sitting, but maybe they have a postural issue. Maybe they have weakness to their trunk muscles or their core that can't keep them upright. This picture too happens a lot with chairs that are too deep. We find this a lot for, have one patient in particular that comes to mind. He had a very expensive chair. It was expensive. He was personally attached to it. It was a nice, fancy armchair. However, for his body size, the chair was just way too deep. And so it wasn't providing enough support. And he was sacral sitting, like he was in this position, sitting in the chair. He said when he first got in the chair, it was comfortable, but after a while, just started to hurt. And he was very, very attached to the chair, didn't want to give up the chair. But we've made continuous recommendations based on the posture that you'll probably be more comfortable in a different chair. So sometimes it's not the anatomy that's the problem. It may be actually the seating surface is just not the right size for your individual body. So just being conscious of that. The chair may be too deep, or it may be too wide, or something that's not supporting as much. But keep this picture in mind, because what's happening here is this curve to your spine is exaggerated, putting a lot of strain on the low back. So I've taken this picture here, one, to illustrate where the ischial tuberosity is, that bony bottom part at the bottom of your pelvis. And then this is to illustrate the big musculature that is laying over top of the ischial tuberosity, which provides the cushion. So there's not so much focal pressure from the chair being pushed on the bony prominences here. You have a big cushion here in the lower part of your body, versus if you're doing this position, the sacral sitting. Look right here at the bottom where I'm circling with my cursor, where the force of gravity is going through the body. This part is not as covered right here, which unfortunately is where people end up applying their pressure because they're in a poor position. There's lots of sensitive nerves and blood vessels and things like that in this area that just don't have the cushion as in farther down. That's why it's so important to have a good alignment, aligning with these ischial tuberosities, taking the force of gravity versus in this slumped position. And this picture I've just put to illustrate that it doesn't have to be a wheelchair. It can be an office chair or another chair in your apartment. Just being conscious of having your hips back in the chair like this person has versus being slumped. The forces of gravity are always at play, so you need to be conscious. This is just another picture of sacral sitting, just with the spine only. And hopefully right here, where it says sacral sitting on the picture, you can see that instead of putting the force of gravity acting through the body through the ischial tuberosity, which is up here and has slid forward, the focal point is on the sacrum and the coccyx, this area, and then there's an exaggerated curve to the spine, which then puts pressure on all these nerves coming out through either side. As we just illustrated in this other picture, all the musculature is lower and supporting lower versus up here higher. Where'd my picture go? So the musculature that's designed naturally to support is down here and not up here where the force of gravity and the focal pressure is acting. So there's nothing to cushion up here. So hopefully that's a good picture to illustrate what the spine is doing when you are slumped forward. In the car is an important thing to think about. This is not just in a wheelchair or in a house chair. I'm sure at some point we've all experienced back pain sitting for prolonged periods of time in the car. Well, it may be due to our posture. If our spine is not supported well and we're in a slumped position, it's the same concept. We're sacral sitting, our spine is more flexed, therefore putting more pressure on our discs and then our nerves, putting a lot of pressure on the low back region. So an accommodation or a modification would be make sure that your hips are fully back in the chair. And if you need a support, a lumbar support as it's called, to maintain the natural curve of the spine, that can provide the support to the discs and the back that it needs to keep the pressure off of those nerves. So for driving for prolonged periods of car, being conscious of your posture, keeping upright, making sure that your bones are in good alignment and that we're not slumped. Posture is essential. Posture is a very, very important thing. So this last picture I have just illustrates a normal anatomical position when sitting to offset the forces. This person is sitting how they should. The ischial tuberosities here are aligned perfectly with the seating surface, which is this cartoon box. And then, as you can see, there are focal points where that pressure is being applied. However, because the musculature is much more thick here in the bottom, it can provide a cushion between the bones and that seating surface. Also, it's taking pressure off of the sacrum, which is this big fused bone area, and the coccyx, and the low back is in good upright alignment with its normal curve. So that when you're thinking of sitting, this is the ideal. You're sitting upright, your ischial tuberosity, as they're called, are supporting the weight and the axis of your back, and the force of gravity is acting through the ischial tuberosities, versus if you're slumped, it's acting through the sacrum here and the coccyx, which aren't designed to support the weight in that way. This person is going to be able to sit for much longer periods of time versus somebody who is slumped in this position where all the pressure is here on the low back region versus where it's designed to be supported. So that's all. This is just a quick overview of posture and recommendations for if you have pain in sitting. It may be that your posture is wrong, or it may be that you slumped in the chair and your bones are not designed to support the weight that way, and you're putting a lot of focal pressure on the nerves. So the fix would be to sit with your hips back, your back supported, whether by a cushion or a pillow or something. You can even fold up a towel and put it back here. And then just being conscious of your posture. This is sitting in a wheelchair, sitting in a regular chair, or even sitting in the car, being conscious of that. So again, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. Thanks, and have a good day.